We have Amy Elgersma, CAO, Mayor Kenny Bell, and I'm sure everyone is well aware of who Dr. Patterson is, as we've seen his face for the last 19 months really regularly. So thank you everyone for coming.
As Stephanie said, thank you very much for coming today, guys. I just wanted to first share my thanks to the citizens of Iqaluit for their patience in our in this mess that we find ourselves in. You know, to the City of Iqaluit staff who have been working endless hours, you know, into the morning, sometimes up to 2 a.m. in the morning, to provide services to our citizens during this difficult time. To my left is, of course, the now famous Dr. Patterson, and he will be giving an update on the findings and a high-level overview. And to my right is Amy Elgersma, our CAO, who will be talking about next steps for the city. And there we go. So, Dr. Patterson. Oh, sorry, I'm switching the order. It's going to be Amy first.
Thank you, Mr. Mayor. I'm going to speak to you today a bit about the city's investigation. We've made significant progress on the investigation into odors found in the city's drinking water. A high concentration of odor was discovered in one of the in-ground water tanks at the water treatment plant. The results of water quality testing show exceedingly high concentrations of various fuel components in the sample collected from that tank. The city has been able to isolate the tank and bypass this tank. The contaminated water is currently being pumped out into trucks and transferred into holding tanks to prepare for treatment and remediation. Once the affected tank at the water treatment plant is emptied, an inspection of the tank will be conducted to determine how contaminants entered that tank. Any other remedial work will be determined based on findings of the inspection. It's important to note that the water quality testing of the treated reservoir located downstream from the water treatment plant showed levels well within health limits. So this part is very good news. To remove any potential contamination from the plant and distribution system, the city started flushing the water distribution system yesterday. We expect to continue flushing the system for an additional 48 hours. Once the flushing is complete, residents will receive instructions via public service announcement to flush their home pipes by running their water for 20 minutes. Testing and monitoring will continue over several months. The city and its water engineering consultants suspect that contaminants outside the plant in the soil or groundwater have entered the tank from the exterior. The city is undertaking an environmental site assessment, phase 2, which includes examining historical information of the area, drilling boreholes, digging test pits to sample the soil and groundwater to test for contaminants. Next steps will be determined based on the finding of the environmental assessment. The city will provide any additional information as it becomes available. Thank you very much.
Thank you very much, Amy. Dr. Patterson.
Thank you, Your Worship. So for all Iqaluit, we can give more information about the health concerns, and we understand that at the top of everyone's mind is whether or not they've been, their health is at risk because of the events of the last 2 or 3 weeks. And the best evidence that we have available right now indicates that the risk of long-term health effects is not a concern at this point. The compounds that we were most concerned about, like benzene and toluene and other chemicals that may have been identified as carcinogens, there's no evidence that those types of chemicals, there's no evidence that they've been present in Iqaluit's water system. Individuals who consumed water that had been heavily contaminated may get headaches, may have gotten upset stomach and diarrhea, symptoms like that would resolve generally within a few hours as these hydrocarbons pass through their system. So once the water system is flushed out and we're certain that it's gone, then we should be able to return to normal use, including consumption of the water system. And we'll be able to make further announcements on that as the flushing continues and as the further tests are done to confirm that the contamination is out of the system, the water system. Thank you.
Thank you, Dr. Patterson. I'll now open the floor for questions from the media. You have to use your mic, and once it's on, you have to state your name. Go ahead. No, sorry. There you go. Number one was first.
Kevin Gallagher, CTV National News. Dr. Patterson, you said that there was no carcinogens found in the samples, but what was determined amongst the samples? What have people been smelling in their water?
They've been smelling hydrocarbons most consistent with either diesel fuel or kerosene. Those are two of the more likely mixtures that have caused this contamination.
Jackie?
Jackie McKay, CBC News. Can you tell us about the quantity? Can you put it in terms that we would be able to visualize?
Sorry. This new system is, there we go.
Yeah. Do me.
Thank you. Sorry about that. And then
It's too soon to give to comment on quantity. Until we get more information about the spill and how it got in there, I can't give an accurate comment on that.
David?
Yeah, David Venn, Natsiak News. Was the contamination worse in some areas of the city compared to others? And if so, which areas?
Thank you for the question. The reports that we received about the odor were intermittent. It was hard to determine if there were higher concentrations in one section of town or another. Early calls suggested perhaps the plateau or the road to nowhere, but it was hard to tell because a lot of the comments were on social media and weren't called into the city right away, so that was challenging. But because the contamination is at the water treatment plant itself, it would be fair to say that it wasn't concentrated in one particular area of town.
Right?
Okay. Residents were reporting this for up to 2 weeks ago. Why hasn't action been taken sooner, given how many reports were streaming in?
So the first day that we started hearing, we heard that there was a report of fuel in there, a smell of fuel in the water was on October the 2nd. The city sent out its crews to investigate right away. The next day, Sunday, we opened an investigation. We called public health officials. We met with public health officials on that Sunday, and we started looking into what was going on. On the Monday morning, we sent out rushed samples to a lab to have those analyzed. We reviewed all of the city's water logs and data, inspected water treatment, the other water facilities and pump stations and so on. And then we continued our investigation. We secured a water engineering consultant to assist with the investigation, and we monitored the situation and started working on testing programs. So the city did take this very seriously. It was unknown and it was very challenging to understand what was going on at the time, given that there was a lack of concentration in one area. Test results that we had seen, as far as our disinfection was in good shape. So I will say the city absolutely took it seriously and started investigating right away, as well as bringing in additional experts, hiring water engineering consultants, and bringing in additional expertise as needed.
Go ahead.
Kevin Gallagher again. I just wanted to know, maybe Amy, you could answer this, but is there any chance, right now, you're saying that the contaminated water container has been bypassed and the system is now safe, but how do you know there aren't other areas of the water treatment facility that have been affected? What has been, determined from that investigation?
The tank that contains the high concentration of contaminants has been isolated. Currently, the city is flushing the system to remove remaining contaminants and potential contaminants from the rest of the system. So that's part of the flushing program. And as I mentioned earlier, once this flushing is complete, residents will then be asked to flush their systems to ensure that any hydrocarbons in their systems are also flushed out of the system. And then the question is, how will we know that the water is safe at that point and that we don't have hydrocarbons remaining in the water? That's through the specialized testing that we are undertaking. So we are undergoing a rigorous testing program to ensure that there are no more contaminants in the water. And yeah, thanks.
Brian? Yeah, I'm going in the list of who's on this thing, so I know you, David, sorry.
This one's probably for David Venn and Natsiak News. This one's probably for Dr. Patterson. Are the health effects different for pregnant women and children versus other adults?
We were worried that that might be the case, which is why we'd put out some different advice for infants and pregnant women. But with these substances, we can assure everyone that it's safe for pregnant women and infants to bathe or wash with this water. It's important to note that that the do not consume order hasn't changed and won't change until we've finished flushing and rechecking the system. Thank you.
Jackie?
Jackie McKay, CBC News. What does this tell us about how long we will be under a do not consume order?
I think it'll be into middle or second half of next week before we can, at least for the people who are on the piped system, before we can think about lifting the do not consume order.
There you go, yep.
Emma Tranter, the Canadian Press. You said that the smell is concentrated at the fuel was found in the holding tank. What does that mean about the water in the city? Can you clarify more how much fuel would be in the water that's coming out of our taps?
It's very difficult to quantify water that may be in the tap water. What we do know is that we've been able to contain the concentrated, the tank where the concentration is found. Speaking with experts from Health Canada today, they've indicated that smelling an odor, you smell an odor first in advance of any real negative health effects. So an odor may come first before you, it kind of stops you from drinking the water. So the contaminants currently in the system, we believe are quite low, but residents still may smell odors during the flushing program.
Trevor Wright, Nunavut News. Have you guys determined a cause, or have you guys ruled out or determined a cause of this? Like, is it from a burst fuel pipe, or what's up?
Yeah, so that's a really good question. Once the tank is emptied, we started emptying the tank today. We'll be able to complete an investigation of the interior of the tank to see where this contamination is coming in from. In parallel to that work, we're also conducting an environmental site assessment, and we'll be taking samples from around the plant, in the vicinity of the plant, to find out where this contamination is coming from and how did it get there. So it's we expect we may find some cracking in the tank somewhere, and that's how there may be some contamination that has somehow, it's on site somehow, and it may have seeped through cracks in the wall. That's where our investigation has led us at this point.
Kelly? No?
Kevin Gallagher,
Kevin?
CTV National News. As far as that investigation, I mean, there is a diesel-powered power generating station next to the water treatment facility. Are there concerns that there could have been seepage or contamination from that site?
Yeah, the environmental site assessment is going to look at all the possibilities, and the tests will help determine where the contamination may have come from.
Kelly?
Hi, Kelly Grant from the Globe and Mail. Can you tell me what's happening now with services at the hospital? Because I understand there had been some concern about using the water to sterilize instruments, and that may be affecting things like operations. Now that you know a bit more about what the situation is, how's that affecting the hospital?
Now the hospital, the operating room is on limited capacity. It's emergency surgeries only because two reasons. One, there was concern that if there was film in the water, surgeons and the scrub nurses would not be able to properly sterilize their hands. And there was also the concern with a steam autoclave that the vapors at high temperatures and under pressure could be dangerous. So they're using limited, like, instruments that can only be used once as much as possible, and are saving instruments for sterilization either later or shipping them south. That will continue for at least the next few days until we know that it's safe to resume normal operations at the hospital.
Jackie?
Jackie McKay, CBC News. You were talking about flushing the system and needing to do that. The city already has had a water shortage for quite some time. What risk does that put us in for having enough water in our reservoir to get us through the winter?
Yes, this is a concern that we all have. As we all know, the City of Iqaluit has a water shortage. We've declared emergencies 2 separate years due to water shortages. The city has an annual pumping program now to pump water from Apex River into Lake Geraldine to ensure that the reservoir is topped up so that we have enough water for the city for the winter. So we keep a very close eye on the reservoir levels. This year, we were fortunate to have a lot of rain, and that has helped keep the reservoir at a high level. So we are monitoring those levels. But going into October, we were in a really good position with the reservoir level. So we don't anticipate having to remobilize our pumping program right now. But we are monitoring the situation closely because that is of the utmost priority, is to have a topped up reservoir for winter.
David?
David Venn, Natsiak News. Do you know why, Amy, this is probably for you. Do you know why the city's initial daily tests didn't catch the contamination? Is there something wrong with the testing? Were the right substances being tested for?
So the city's daily tests focus on disinfection and chlorine levels, pH levels, temperatures, and so on. So those tests were not catching hydrocarbons. If it was a bacteria or something else in the water, we would have seen chlorine levels changing and variations in some of the other tests, and we didn't see those. On the 4th of October, we rushed out the hydrocarbon tests, samples from various points in the distribution system. The staff didn't have the specialized BTEX kits. The Southern Lab advised us to send the samples down in other testing bottles that we had. These samples likely lost potency during transport down, which we're attributing to the bottle type. The city, though, as part of the investigation, the next day ordered the specialized kits to be able to continue testing as part of the investigation. So that's what we believe happened with those tests, because they came back negative.
Emma?
Some people have, Emma Tranter, the Canadian Press, some people have expressed concern about pipes being contaminated after the fact. Can you clarify, does this flushing process for 20 minutes get rid of that risk? What does that mean? Will we be okay to use the current system after flushing?
Yeah, so after the city completes the flushing of the water treatment plant and the entire distribution system, so all of the city's main lines, pipes, pump stations, and so on, that's when the residents will be asked to flush their lines for 20 minutes. And this is a recommendation from the city's water engineering consultants after reviewing the American Water and Wastewater Association guidelines for this type of situation. So those are established guidelines that have been recommended for the city to use in this situation. And again, the testing is very important. So we wouldn't recommend drinking the water, of course, until after acceptable test results have been received. And of course, when public health lifts the do not consume order.
Just wanted to make it clear for the people watching at home, this is being simultaneously translated. The recording will be available like shortly after the meeting, on the city website due to technical limitations. Thank you. Kevin?
Yeah, Kevin Gallagher, CTV National News. When the do not drink order was put down, there was also an ask for federal help to deal with the bypass. Was any funding or any help from the federal government, did that come down to help with the bypass from the water treatment facility?
There's been no ask of the federal government at this point.
Okay.
The only thing we asked from them is the water license. And that's why the government in Nunavut also declared an emergency to make that, expedite that process. Trevor?
Trevor Wright, Nunavut News. What's the city's water truck capacity or water logistics? What's the city's capacity for that? How many water trucks does the city have, like operationally speaking?
City normally operates with 3 water trucks. We do have a 4th spare water truck. We have brought that unit back into operation for this response. Those water trucks are needed to deliver truck services water to homes and businesses that aren't a truck system. In addition, the city has hired a local contractor who has a water truck. So we have their driver and their water truck, and that truck is being used to deliver water to the water filling depots. So we've upped our capacity, and our pumping rates have improved significantly. At the start of the response, pumping from the river was taking about an hour to fill 1 truck, and now we're down to 15 minutes. Of course, there's additional time required to get the trucks to town. They have to drive, to the park, along the park road and into the city. So residents have experienced some delays receiving a truck service water. But as of today, we're in much better shape, and we've made some adjustments to our route to add some efficiency in, and now we're back on track with our schedule.
David?
David Venn, Nunavut News. If the city's daily tests couldn't test for hydrocarbons or what people were smelling, then why wasn't a notice put out sooner?
Again, at the time, there was it was difficult to determine what the issue was. So we didn't know that there were hydrocarbons in the water. People were smelling different things. It wasn't consistent. So that's why we initiated the investigation and brought on a number of experts to help us with that investigation, as well as ordered the specialized tests.
Jackie?
With this information, what does it, Jackie McKay, CBC News. With this information, what does it tell you about the capacity that the city has to deal with this? Are you asking for anything physical, financial from different governments to be able to deal with the problem?
Yes, thank you. So we've received support from the government of Nunavut. As you know, the city declared a local state of emergency, and then that helps us gain some additional resources as needed. So the government of Nunavut had made a number of some equipment and other resources available to the city. So they offered things like pumps and tanks to the city. In the meantime, the city was able to secure some of those things from local sources, but those things were offered. They've assisted the city with some additional communication support and offered some additional assistance from staff. And they've purchased, I think they're approaching 200,000 liters of bottled water to date that they've flown in on charter and such. They've also commissioned a mobile water treatment plant that they're looking at installing. So they're working on that, as well as the city will be applying to government of Nunavut for some of the costs it has incurred during this emergency, to pay for some of our consultants, to pay for parts of the investigation, supplies that the city purchased, and so on. So the city is looking at finding sources of funds to help recover the costs that it's incurred in the response. And then, of course, there's the additional costs that will be needed to fund any remediation efforts that may be needed or corrective measures as a result of what we may find in the tank investigation or the environmental site assessment.
Kevin?
Kevin Gallagher, CTV National News. This question is probably for Dr. Patterson, and you might also have to forgive me for my lack of hydrocarbons and how they're refined, but you're talking about something that's between diesel and kerosene. Is this something that could have occurred naturally? Is this something that could have come from melting permafrost or errant wells? Like, how many things have been ruled out here in the process of elimination that now you're undertaking?
this wouldn't be natural. This is not something that you would find. These aren't compounds that you would find just sitting on the ground or anything like that. Beyond that, nothing's been ruled out. It could be an old spill that's been liberated with melting permafrost. It could be damage to the infrastructure, as Amy mentioned. There's a number of things, but it's not natural. Thank you.
Jackie?
Jackie McKay, CBC News. Do you have a number for how much this emergency has cost the city?
I don't have that information for you right now. This is an ongoing response, so we don't have those numbers ready.
David?
David Venn, Natsiak News. Apologies if I missed this, but will there be more samples or sampling to ensure that residents did not consume any other contaminants, such as the ones that Dr. Patterson mentioned?
The government of Nunavut is undertaking significant testing right now, and the city will continue the testing and monitoring in the months that come. So these same specialized tests are going to continue, and we're going to be able to look at the levels that we have now, the results that we have now, and compare them, and hopefully watch them go down until they're negligible.
If everyone is good, again, I'll remind the people watching that the Inukshuk version of this will be on the website relatively soon. I don't have a time frame, but we'll put it up as soon as possible. And thank you all for coming, and thank you for watching. And please bear with us while we're, responding to this emergency for the city. Thank you.